We live in an era where inaccurate and misleading information can spread quickly. Fake news has the ability to quickly go viral, whether it's deliberately created or the results of an error, mistake, or misinterpretation. But a group of doctors, researchers, scientists, and professors are trying to combat it during Together Against Misinformation Week. Dr. Jen Gunter is an OBGYN and author and joins me today. Thanks so much for being here.
Thank you for having me.
So, Dr. Gunter, what is this week all about that you're a part of?
Well, it's all about bringing attention to the crisis of misinformation, specifically misinformation about science, what we can do about it, how we need to recognize it, and really what are the steps we need to be taking.
So we see through studies that misinformation spreads faster, farther, deeper, and more broadly than true, real information. Why is it important to you to work towards combating that, specifically in your industry?
Yeah, well, misinformation affects all of us often in ways we don't even see. But for me as an OBGYN, I see patients affected by it on a regular basis. I see people who are afraid to get the HPV vaccine because they believe that it's unsafe, when that's not true. I see people who maybe live in other states from where I live, and they're having difficulty accessing the full scope of reproductive health care. We are in the States are seeing women dying from being not able to access abortion services. And the reason why all these laws have been allowed to stand or pass, or that people are continuing to vote for them, is they're misinformed about what's actually at stake. So we see personal stakes, I see stakes with my own patients, and I see stakes from people who I don't interact with, but I really feel for as another human.
Politics aside, how do you broach those subjects when your patients come in and are saying things to you or are hesitant about your care or the care that you are discussing with them because of misinformation that has been spread? How do you have that conversation?
Yeah, so the kind of conversations you have one-on-one tend to be a little bit different than the conversations you might have online, or at a public event. So one-on-one, what I'm trying to do is get that person to gain trust. So hopefully they'll start to see me as somebody that they can trust as a source of information, and they'll come back. And sometimes you have to leave some subjects alone. So if someone comes to see me and they're coming for one health condition, and I notice that they haven't had their flu vaccine or their COVID vaccine, I'll bring it up. So sometimes they just didn't have time. But sometimes I get a lot of pushback, and I wait to see if it's a time for me to maybe have that conversation, or I'll try to plant, the concept that, hey, you trust me enough about your chronic yeast infection problem that, maybe you might want to hear what I have to say about this other issue too. But, in the office, it's a little bit of a different approach than it might be when you're trying to talk to a politician or trying to talk to the members of the public or interacting on social media.
When it came to vaccines, this is something we saw a lot of that then transferred not just from that COVID vaccine into other vaccines in people's lives, but when we put the vaccines aside, when we start talking about maybe some other things that people can talk about, fad diets, diet culture, how do you start seeing that negative impact, and what kind of things are you hearing from people or seeing online that can be really detrimental to people's health?
Well, I think a big one that we see certainly in the realm of women's healthcare is this idea that you can somehow balance your hormones with food, right? That there's some kind of ultimate hormone balancing or hormone health diet. And what happens is that leads people often to some very destructive eating patterns. It can lead to anorexia, it can lead to binge eating, it can lead to issues with body image. So that can be very, very harmful to people when people have these kinds of dietary patterns in their 20s or 30s. That can set them up for actually osteoporosis later in life. And then often what happens is, these diets come along with supplements, because misinformation and supplements tend to go hand in hand. And people may then be at risk for taking supplements that could be potentially harmful or at best are unstudied. So diet culture certainly is unfortunately an avenue into misinformation.
Oh my goodness, I think we've all seen it when we've scrolled on TikTok late at night and it says, I'll show you how I lost that last 10 pounds. Click here for the supplements that did it. I think we've all seen those. So what things do you look for to help spot misinformation? What are some tips that you have for people?
Well, I think the biggest tip is if it sounds too good to be true, it probably is. That's really hard for us as humans, but it probably is. When somebody doesn't have a medical degree, when somebody is talking with absolute confidence and they're not a scientist. Now, unfortunately, we see disinformation from doctors and PhDs as well, but it's a good way to kind of to try to help separate things. If somebody is selling you a product, they can't be a salesperson and your health educator at the same time. I think that's probably my biggest red flag is what product are they selling? And always be aware about what guidelines from Health Canada say so you can have a reliable source to fact check. The truth of the matter is Health Canada does a really good job most of the time giving you accurate information.
Dr. Gunter, thank you so much for your time today.
Thank you for having me.